That steep rise in cases locally is disconcerting, says the district's medical officer of health, but she expects those numbers to continue to rise. And from now on, those outside of high-risk settings who are confirmed to have the virus will be responsible for informing close contacts themselves. Corey Nordstrom explains.
Medical Officer Dr. Janet DeMille has confirmed what many expect about the massive jump in cases seen in the Thunder Bay district.
I think what's happening is basically we're now being impacted by what's happening in the rest of the province and in other parts of the country. That it's largely this new variant of concern, the Omicron variant, that's spreading.
DeMille is also on record saying that there is community spread in the Thunder Bay area. With that, the TBDHU is changing its process for contact management. Health unit staff will focus on follow-up for high-risk settings with more vulnerable populations.
Any cases in a long-term care home or retirement home or other congregate living settings, cases associated with hospitals, for example, staff or a patient in a hospital. Schools and daycares are also something that we will be following up on.
For the average person, informing close contacts will be their responsibility after testing positive, with guidance from the province. Dr. DeMille says now that Omicron is here, following up with hundreds would be too tall a task, especially when staff are needed on the front lines.
It would be virtually impossible for us to do all the case and contact management the way we've done in the past. So, and what we are trying very much to do is divert some of our resources or reallocate our resources to immunization.
Ontario's top doctor is slated to speak Thursday, most likely about whether schools will be open next week. DeMille did not want to talk about her recommendations for in-class learning in this district, but she's hoping for some other changes to be announced by Dr. Kieran Moore and Premier Doug Ford.
I do expect to see more requirements for household members to isolate, even if they've been vaccinated with 2 doses. So that will put a burden on people and families, but it would actually help mitigate some of the transmission that we're currently seeing.
Corey Nordstrom, TBT News.